Morning everyone. We are live today at Sakra World Hospital, Bangalore. We have today with us with Dr. Adil Sadiq, Senior Consultant and Head, Adult Cardiac Surgery, Institute of Cardiac Sciences. We'll be discussing related to minimal invasive cardiac surgery today, uh, benefits, risk, also answering few queries which you asked for us. Doctor, can you brief us about minimal invasive cardiac surgery?
Well, thank you so much for that introduction. I mean, at the outset, nobody likes having surgery, least of all, cardiac surgery. So when it comes to cardiac surgery, everybody is scared, and that's when minimal access surgery comes into play. Now, minimal access surgery is when you operate on the heart without making any big cuts. Normally, a heart surgery requires you to have a big cut across the chest. You cut the chest bone, approximately around 10 to 12 inches. But minimal access surgery, you approach the heart through very small cuts, maybe 2 or 3 inches, or through endoscopes. You operate on the heart without cutting any bone, and that gives a lot of benefits. Cosmesis is the least important then. That means the size of your scar is the least important. What's most important is your return to normal activity. Compared to normal surgery, where you get back to activity only after 8 to 10 weeks, here you may be able to get back to surgery, after surgery, get back to normal activity as early as 2 to 3 weeks. So that's a big different thing. Also, there is less pain, less need for blood transfusion, less chance for an infection, and all these adds on to its benefit. If you ask me to draw an analogy to minimally invasive cardiac surgery, it's about taking your car to the mechanic for a repair. Usually the mechanic switches off the engine, opens the bonnet, and then does the repair. Well, in minimal access surgery, 1, we don't even turn off the engine. 2, we don't even open the bonnet. With the engine running on, I pull off the headlight, put a little camera in, and I fix the engine. That is minimal access surgery.
It was very informative, doctor. And here we have few questions from our viewers actually. If I have a heart surgery before, does that affect my changes for MICS?
Well, thanks. That's a very interesting question because many people who have had heart surgery before may require heart surgery a second time. Well, specifically today, we get a CT scan for patients and we look at certain parameters from a medical aspect. And if they are good, you can still have a minimal access surgery the second time too. So yes, it is possible.
Okay. Let's move on to second question. When do I know I need to opt for MICS specifically?
Well, everybody who gets referred for cardiac surgery, not 100% are fit for minimal access surgery. Having said that, out of every 100 patients who get referred for cardiac surgery, almost 75 to 80% are fit for minimal access surgery. So if anybody's been advised, heart surgery, you need to take an opinion whether you're fit for minimal access surgery.
And third question, what is a healing period after the surgery, doctor?
Well, the body is really amazing. After any surgery, the healing starts almost instantaneously. What helps minimal access surgery is that you do not cut any bone, and therefore you do not really need to wait for the bone to heal. Typically, patients are out of the hospital by the 4th day or the 5th day, and they're back to work 10 days post-surgery. 2 weeks post-surgery, they're back to driving and doing everything. I've had many patients who've gone back to swimming 2 weeks after minimal access surgery. So that's the kind of healing we're expecting. Once you're home, you don't really need any kind of daily dressings or anything to be done. The scars quickly heal up. Of course, the rate of healing is very different. The rate of healing in children and younger people is much faster than it is in much older individuals.
That's great, doctor. What would be the success rate for the type of surgery, minimal invasive?
Well, minimal invasive surgery encompasses different kinds of surgery. So the success rate varies depending on the complexity of the procedure between 96 to 99%. So this kind of mirrors the success rate of regular cardiac surgery, except that the benefits that I told you, all of them make sure that the patient goes home faster with less pain, less need for antibiotics.
Okay. Does being diabetic affect the surgery, doctor?
Actually, it does, but it affects it in a positive sense, in that sense that if you're a diabetic and you have minimal access surgery, your healing is going to be faster because the incision is smaller, no bone is cut, there is less chance of infection. So this is specifically recommended for diabetics.
Doctor, I've heard that MICS surgery is lesser pain and faster recovery. How different is it from other surgery, doctor?
Like I said before, in the other surgery, a bone is cut. It's probably a 10 to 12-inch cut. So the amount of time needed for healing is that much longer. Normally, if you have a fracture, you put it in a cast, you remove your cast after 3 to 4 weeks. Here, there is no need for anything like that. You don't cut any bone. Secondly, the pain is a fraction. I mean, I would not say that minimal access surgery has zero pain. That would be incorrect. But on a scale of maybe 1 to 10, 1 being least amount of pain and 10 being most, minimal access surgery is around 2 to 3, and regular surgery may be around a little more than 5. So definitely there's a 30 to 40% reduction in the pain that you have.
Doctor, any patient coming to you, what is the factors you will check he is eligible for MICS surgery, doctor?
Well, we do have a very long checklist. Safety is key in this surgery. It's not just about doing through small cuts, but giving the same equivalent results. So we do have a selection criteria. One of them is a lung function test. We get a CT scan. We do a lot of tests on the liver, lungs, kidneys, and only after thorough checkup, if we find out which patients are suitable and maximally beneficial by this procedure.
Is there any types of MICS surgeries available, doctor?
Well, MICS encompasses a whole lot of surgeries. It starts off from multi-vessel beating heart bypasses to valve replacements, to valve repairs, to closing holes in the heart. All of them are part of MICS. So practically the entire spectrum of cardiac surgery, whether it is a bypass surgery, whether it's a valve replacement, valve repair, or closure of holes in the heart, or surgery for abnormal heart rhythm, all of them come under MICS.
Okay. Is there any age factors, doctor?
Yes. As of the instrumentation available today, a lot of endoscopic and minimal access procedures are usually given to people above the weight of maybe 25 kilos. As of now, we don't have instrumentation for children below the age of 25 to do minimal access heart surgery. But anybody above 25 kilos or approximately, maybe 4 or 5 years of age is suitable for minimal access surgery. The upper extreme is not a limit. The older you are, the more benefit you're going to get from minimal access surgery. The oldest we've operated here at Sakra is an 86-year-old lady for minimal access surgery.
Doctor, we have a comment. I have read about your work with Izaki procedure. Could you elaborate, doctor?
Well, I could go on speaking for an hour on Izaki procedure, but to just give you a brief, the Izaki procedure is kind of a breakthrough in which we replace the valve of a patient by reconstructing it by the tissues that are there in your own body. Usually, when a valve needs to be replaced, you either put a mechanical valve, means it comes from another animal. That has its own drawbacks, it's more expensive. Here, it practically costs nothing. You use the body's own tissues, and at the time of surgery, you recreate and reconstruct a valve, specifically the aortic valve, for you. So it's cheaper, it lasts longer, and it's better. So I think it holds a lot of importance in the Indian context.
Hopefully we have answered your comment. And what is a lifetime changes we need to maintain for this MICS surgery, doctor?
Well, the reason why many people get heart surgery, for example, if you think people have blocks in their heart, the most common reasons are like diabetes, smoking, cholesterol, bad food habits, lack of exercise. No matter what kind of surgery you do, whether it's minimal access or your regular heart surgery, you need to change your lifestyle, which means you need all the factors that are causing the heart problem in the first place need to be dealt with. You need to read a regular exercise schedule. You need to have a diet control. You need to keep diabetes in check. And most importantly, what scares me and what I see here commonly in this part of Bangalore is the number of people who smoke and come in with 100% block. So smoking is an absolute no post heart surgery.
The incisions made during the surgery, will the scars, everything fade away with the time, doctor?
Well, the scarring in an individual varies from person to person. The scar is small, it's only maybe 20% of a regular scar, but whether it actually is visible or not depends on the individual. A lot of the time, 60 to 70% of the time, the scar fades away. In women, the scar is hidden below the mammary tissues, so it's really not seen. But in some individuals who are prone to more scarring, who are genetically more prone to scarring, they may have a scar, but largely it fades away with time.
We have another comment.
Sure.
How do you make sure that you have a healthy heart?
Well, the healthy heart starts with you. I can go on about it. You need to be careful about what you're doing. Let's take a simple day. You get up in the morning, you don't have breakfast, you rush out, have a shower, go to work, listen to the radio, and as soon as you grab it out there, it's one cup of coffee, a little donut. Well, that's all wrong. You're starting it all on the wrong foot. You need to know that as soon as you get up, you need to have some kind of exercise into your life. It could be something in the morning, it could be something, that's fine. But you need to have a regular exercise schedule. And I don't encourage people to exercise 7 days a week. You need to get a break from exercise too. So exercise 5 or 6 days a week, but stick to it. Have your breakfast within an hour or an hour and a half of getting up. Don't skip your breakfast. Your breakfast is the most important meal of the day. It needs to be the largest meal of the day. The dinner is the least important meal of the day. Unfortunately, people have it inversely. Their breakfast is nothing and their dinner is huge. So that really amounts to a lot of problems that people have. And apart from that, like I mentioned, stopping smoking or the company of smokers is very important.
Okay, doctor. Hopefully we have covered all the points, and we have a comment again.
Oh, sure.
How many years will a stent stay? Stent.
Nobody can answer that question. I have seen a stent work for 12 years, and I have seen it go down in a very short period of time. So a stent is a foreign body. The normal tendency for the human body is to reject a stent, and to prevent this kind of rejection, the stent has some kind of medication in it. It's some kind of an anti-cancer medication which lets it be in for a long time. So the durability of stent not just depends on the quality of the stent, but also on the patient factors, and it's very, very variable. It's like asking somebody, how long does it take for you to grow your hair shoulder length or waist length? So it's very different. Okay, so everything overall that you have out there, everything is relative. Everybody's body is different. Everybody's body reacts in a very different way, and therefore everybody's individualized. Like no two children in a classroom are the same. Everybody's different. So that makes a thing out there. People often come up and tell me, Dr. Adil, is minimally invasive here only for a short time? Is it going to stay? Why isn't it popular in India? And I just tell them one thing. I said, today we are at the same horizon with minimal access surgery as we were with laparoscopic surgery 20 years ago. 20 years ago, if somebody told you that you will operate on your pancreas through a keyhole, people would laugh, including doctors. But today, it happens, all right? And so much so that even if you go in the remotest of interiors of India or any Karnataka, any place, and if you want to get a gallbladder removed, people will ask you, why can't it done by a camera? Why does it have to be a cut? We are at the same horizon with minimal access surgery. It's only a matter of time that minimal access surgery is going to catch up. If people want it, it's going to catch up. If people know about it, they will want it. And if people want it, then doctors will also start going on the learning curve to get the skills to provide minimal access surgery to patients. So it's a whole cycle that starts with you, the viewers as well. So that's the whole thing with minimal access surgery as well. So I think it's only a matter of time that happens. In the United States as well, 20 years ago, minimal access surgery was practically done in maybe less than 2% of hospitals, and today almost 40% to 50% of hospitals in the United States do minimal access surgery. So it's a long way to go.
Okay, doctor. Would you like to add on any points for the viewers who are watching, like any side effects or anything about minimal invasive surgery? If you want to add on some points for the viewers.
Correct. I mean, we need to have a realistic approach to minimal access surgery. If somebody tells you that every surgery is 100% successful, that's not true. It's not possible. The success rates, like we discussed, are more than 98 to 99%. There's always a 1 to 2% risk of complications that can happen in any surgery. And these complications are probably lesser with minimal access surgery than with other surgeries. However, minimal access surgery is not for everybody. Just like it's not for every surgeon. There's a learning curve. You need to crawl before you learn to walk, and you need to walk before you learn to run. So there is a learning stage for it. There's a cost difference as well in minimal access surgery. Thankfully today, so many things are made ingeniously in India that we've been able to reduce the cost difference between a minimal access surgery and a regular surgery to maybe just 20,000 rupees. That's it. Less than 5% of the total cost. That's the only difference. So minimal access surgery is here. It's getting to be more affordable. It enables people to get back to work much earlier, and that makes the whole difference.
It's my personal question, doctor.
Yes.
What is the hospital stay if a patient is admitting for MICS surgery here
Yes.
in Sakra? What is the hospital stay for the patient?
So entry, the day after surgery, probably the third day after surgery to fourth day after surgery, the patient's ready to go home. Okay. So patient usually comes one day before surgery, so then you can do the math. So that's what it is.
Good, doctor. Wall replacement surgery is dependent on prosthetics. We have a comment on that.
Yes, absolutely. If you want to have a beautiful, I just remember Niki Lauda, the Formula One racing driver, and he said, whether you win the race does not depend on the driver. It depends on the engine. And he was talking about Ferrari and McLaren and everything. Absolutely. How good your valve is depend on your prostheses. There are different kind of prostheses available in the world. There are Indian make ones, there are foreign make ones, there are mechanical ones, there are biological ones. So not everything is perfect. Some of them have their own advantages, some of them have their own disadvantages. So you need to sit down with your physician, your doctor, to understand what are the advantages for you, what are the disadvantages for you. So once this is done, and I think that was a question that came in from our viewer. So what are the advantages specifically for you need to be discussed. So you need to know, which one is best for you. It's not like one size fits all trousers. It's not that. Everything needs to be individualized. Yes, and every prosthesis has an advantage as well as a disadvantage.
Doctor, one more comment.
Sure.
Does resting heart rate make sense as a heart health? What does wall mean exactly?
Okay. All right. Can we rephrase that question out there? I didn't get that out there. So does one of our viewers is keyed in, does the resting heart rate make sense as to heart health? And what does the resting heart value mean? Okay, let me tell you something. Yes, the resting heart rate does make a big difference. Simple analogy. Let's take the engine of a car. In the engine of the car, you have 2 meters when you look at it. One is a speedometer, which tells you the speed at which you're going, and the other one is the revs, that is the revolutions per minute. So even when the car is not running, the revs will be on. It's called the idling speed. So your resting heart rate is the idling speed. As a mechanic, as an engineer, anybody would know that in case the idling speed is too high, your car burns more petrol and does more wear and tear. The same thing with your heart. So an ideal heart rate should be between around 70. It varies from age to age. For a 20-year-old to a 50-year-old, the ideal heart rate should be between, that much. For an older person, for a younger child, it's going to be different. It's going to be higher for a child. So depending on that, so in case your heart rate is out of tweak, your heart rate is in the 120, 140 range, that is going to affect the way your heart or the engine of the body is going to behave.
Some information on open heart surgery, doctor.
Okay, so really everybody says open heart. What does open heart mean? Well, Well, to do most kind of surgery, what really happens is, you open the front of the chest. It's a large cart, and you open the rib cages totally to gain access to the heart. The heart is protected by a lot of bone, the rib cage. We also use a heart-lung machine to stop the heart and do the surgery. It's called a cardiopulmonary bypass machine. So use of the cardiopulmonary bypass machine, technically in the truest sense, opening a chamber of the heart constitutes open heart surgery.
We have an example here, doctor.
Mhm.
For a patient whose age is 62 and undergo angioplasty 15 years ago for a single block
Okay?
on right vertically, suffering now from 3 blocks, do you suggest MICS surgery or an open heart surgery, doctor?
Well, first and foremost, thank you for the queries coming in, viewers. I think that's what makes the program tick. All this works on your inputs, so keep them coming in. I'd love to go on till time permits. So this particular question says that you've had a block before. We need if the patient is having problems or symptoms, we need to repeat a test, something maybe an angiogram. And if the angiogram now shows that there are 3 blocks, having a previous angioplasty does not change your prospects of having minimal access surgery. In other words, you can still have minimal access surgery. Like we discussed in the beginning, one other viewer had put in a question, suppose you've had heart surgery before, you can still have minimal access surgery. Just because you've had open heart surgery before, or you've had an angioplasty before, or you've had a balloon surgery before, does not affect your prospects of having minimal access surgery. So yes, you can. All right, I think we have some more questions coming in. That's great.
We have another comment.
Yes.
Advantages of MICS.
All right. So there may be, say, let's specifically 6 or 7 main advantages. The least important is the size of the incision. The fact that the incision is small and there's a small scar is least important, according to me, medically. To many of you, it may be the number one thing, but that's the least important. The number one of it is the faster return to activity, 2, lesser pain, lesser chance for infection because there's a smaller amount of tissue that's being disrupted, less need for antibiotics. In fact, you just get antibiotics for 1 or 2 days post-heart surgery. And the other thing is less need for a blood transfusion. Blood transfusion itself carries a risk, and minimal access surgery, we've seen that all this is less. So what's important also is the faster return to work. If you're working in a place, it has its own stress and demands. With minimal access surgery, you're able to get back to your workplace much faster.
We have one more comment, doctor, for
Sure.
2 minutes.
So thank you, viewers. Keep it coming in. I love the questions.
Can Izaki procedure be for everyone?
Well, I would like to say yes, but the answer is out of every 10 patients who come to me for an Izaki procedure, almost 9 of them are fit for the Izaki procedure. Okay, so some of the people who may have diseases of the pericardium is the covering of the heart. So if you have a disease of the pericardium, you may not be suitable for the Izaki procedure. Unlike, valves come in different sizes. There's a certain size of valves. Unfortunately, there are no microscopic valves made for children. But with the Izaki's procedure, you can reconstruct the valves even for children. So that's the biggest advantage, which is not there in a regular valve. So maybe 90% of the patients who come to me for an Izaki are fit for the Izaki procedure.
There's one more comment, doctor.
Sure.
What is a coronary heart disease?
Okay, coronary heart disease. Okay, let's put it this way. You have a metal pipe, like a Tata water pipe, and inside that pipe, if you have soft water flowing, nothing happens. But inside that pipe, if you put hard water, what happens after some time? You see calcium inside. The same thing happens inside the arteries of your heart. And when those little calcium bits and plaques form inside the arteries supplying your heart, that is called coronary artery disease. It goes by many names like plaque and blocks and things like that, but this is the basic idea behind coronary artery disease.
So that's the wrap, doctor. Thank you, doctor, for sharing your detailed information for the viewers. Hopefully, we have answered all the queries of you. And if we have left something, please comment below and don't forget to share this video. Thanks a lot, doctor, for joining this session.
Well, thank you so much. Gone are the days that we would just speak with patients or give a press conference about things. This is the next Gen X, millennials. Everything is out there. The only way to reach out is through social media. We have Insta. I think we're going to have this on Insta as well. We have it on Facebook. So keep pouring it in. And I think for all the viewers listening out here, the more amount of support you give us, the more we're able to do, and we're able to bring out socially responsible messages related to patients' health. And thank you for your support.
Thank you.